Let's take a look at Section 5, which is the other associated feature of disturbances of developmental rates and sequences. Disturbances of developmental rates and sequences is defined as a disturbance in the normal coordination and of the developmental areas: cognition, adaptive behavior, speech, language, fine and/or gross motor, as well as social, emotional, and behavioral. This can be seen in disrupted development, unevenness in development, delays in development, or in arrests and regressions. These disturbances can occur between developmental areas as well as within an area. Children with autism often have delays in some areas, but other areas in which they perform considerably better. There is a particular pattern of having developed a skill normally and then having an arrest or regression. This slide indicates possible problems within areas of development. Some children may have poor gross motor skills but exceptional fine motor skills, or vice versa. For example, an individual might struggle with sports and skills needed for playground participation, but have unusually well-developed skills in art. Maybe you know of a child who talks all the time, but uses speech for echolalia and self-stimulation, not for functional communication. Many children on the spectrum are able to respond to communication, but do not initiate interaction. Some children do much better with written language than spoken language. We also see individuals who have uneven development between areas. Sometimes a child has excellent motor skills, but very poor speech. We often see individuals who have average or above intelligence, but are not able to interpret nuances of language or nonverbal language. There may be a wide variance of performance in academic subjects. For example, a student may do well in reading, but really struggle in math. Or they may do wonderful in math and struggle with reading. Another example of a disturbance between areas would be that student who speaks, but is socially delayed. Parents often describe behavioral arrests, delays, and regressions when interviewed about their child. An arrest in development might best be described as a halt or a stop in a skill that seemed to be progressing normally. A delay in development is when a skill is not yet evident or is slowed beyond the typical developmental milestones. Regression of a skill is when a child loses skills that he previously had. Gathering a developmental history is important in diagnosing and supporting students with autism. You may use the parent questionnaire that's located in your appendix as a framework for acquiring this important information. When thinking about disturbances in developmental rates and sequences, consider the following. Look for disturbances and unevenness in development. Use history, questionnaires, and checklists to assist in information gathering. Remember, history remains the same throughout the evaluation process. Just because a skill is better developed now doesn't mean that it shouldn't be considered. Standardized tests do not provide enough information. Use interview, observation, and other informal tools. Value the information you gain from sources beyond the school environment.